A breast cancer patient who has spearheaded the push for Pharmac to fund life-extending drugs says the funding body needs a total overhaul. While Pharmac has pledged recently to be more transparent in its decisions around funding drugs, it says the main way of doing that will be to remove some drugs that have been on the drugs funding list for too long, and perhaps they've given patients false hope. Terre Maize says she was hopeful that a Labor-led government would deliver better funding, particularly when it campaigned on giving all Kiwis the same standard of high-quality cancer care. She told me every time a fellow patient dies, that optimism takes another hit.
Optimistically, I'm hoping that they're getting the message that there are people dying, and Pharmac is the only, quasi-medical agency that allows people to die. If you were in a car accident or even if you had broken out of jail, stolen a car, stoned out of your mind and wrapped the car around a pole, they would do everything they could to save your life. But for us, it's basically they just let us die. And I read an op-ed piece that said the reason breast cancer medications, among other cancer medications, don't get a lot of traction and nothing happens is because we die too quickly. The median survival for breast cancer in New Zealand is 16 months as compared to 3 to 5 years in other developed countries. So we die before the system changes. I'm an outlier. I was given a year to live 6 years ago. Still here, still working, and so I told the people with the Health Select Committee, I said, you're not getting rid of me that easy. And even if I do die before there's change, the next generation is coming. They're fired up. People are aware now of just how cruel the system is.
And you're saying that we're talking specifically about these two breast cancer drugs we've been featuring for a while, the sort of generic names Ibrance and Kadcyla. You're saying if you had access to one of those, you could live for many more years.
Yes, the median survival, I would need Ibrance. So I do need Ibrance now. After 6 years, I finally had some progression. And so my oncologist has recommended Ibrance, and the median extension of life or progression-free survival is what they really measure. That's the gold standard. If your cancer's not growing and you have a good quality of life, then that to me extends life. So they keep talking about that, but it's really progression-free survival. And the median is 2 years, but there are many women and men who have been taking Ibrance for 5, 6, 7 years, and they're still surviving progression-free, doing very, very well.
Because often, Terry, we talk about the evidence that's out there overseas, and Pharmac does dispute that. They say their own experts have advised them that, well, it hasn't really been established as a very, very effective drug. We're talking about Ibrance and Kadcyla. And we can point to evidence that's overseas and experts overseas that say it's worth funding, and lots of countries that fund it overseas. But you're saying that people that do spend the money and get on those drugs here have had great results.
Absolutely. Many of them have gone back to work or been able to continue work, continue raising their families. And I would dispute Pharmac's assertion that they have information from their experts, because the CATSOP committee has only heard about Kadcyla for first-line treatment, which they recommended for funding based on the science. And Ibrance, they put a hold on. They did recommend it for funding. They have not heard about Kadcyla or Ibrance as a second-line treatment, which is, if you're treated with anything, then you're not eligible for a first-line treatment. So, for example, if you've got a headache and you take a Panadol and you're in the hospital, for example, and you hurt, they say, sorry, you can't have ibuprofen because you had a Panadol. So for life, you can never have an ibuprofen, because that's a second-line treatment. So that's how it's treated.
That's how you feel. You're saying you're shut off from those drugs forever because of a drug you've been previously put on.
Correct. That's what they've approved. Well, they haven't funded Kadcyla, but they approved Kadcyla for people who have not had other treatments. So
Ultimately,
They
Terry,
haven't
this
actually,
comes down
they
to
haven't looked at
funding, though, doesn't it? I mean, effectively, they've got a pool of money, and it comes down to funding, and they say, look, we've got to be very, very careful and clear that when we do fund a drug, we're funding that drug for good, because we can't get people on it and then say, oh, sorry, we've run out of money for that drug, we can't fund it anymore. So, but I guess you're saying that it's not that people are going to be on it forever. They might be on it for a short term. It might not work for them. The doctor might choose something else in his toolbox of medicines. But I guess what you're saying is that they don't have a current toolbox of medicines at the moment to give you.
Correct. They've got one more aromatase inhibitor for me, and then 3 lines of chemotherapy, and then that's pretty much it. Whereas overseas, they may have 10 or 12 different drugs in the toolbox that they could try to extend my life. And you're right, people aren't on them forever. They don't work for some. But like say Pharmac says it relies on the science, but they haven't looked at the science yet. The CATSOP committee has not heard the evidence for second-line Ibrance and Kadcyla. Pharmac also says it's prohibitively expensive, but they haven't negotiated price yet because they've not approved it for funding. So I don't understand how they can say those things.
One thing Pharmac has come out to say in the last couple of months is that they are going to be more transparent and clear about their funding decisions. In recent days, we're getting the idea, though, that their idea of being open and transparent is literally just saying, look, there are some drugs that have been on our list for a long time and they don't look like they're going anywhere, and we want to give people some definitive information because that's what they're asking for. So we're going to remove those drugs. So at least people know they won't get funded. Now, what would you like to see from Pharmac? Would you rather those drugs remain on the list? And of course, we don't know what the ranking is because that's confidential. It's important, as they explain in their negotiations with the drug companies, not to let them know how high or low they're ranked. But would you rather the drugs be kept on there indefinitely, or would you rather Pharmac just come out and say, no, we're not going to fund it at all?
I think I'd prefer honesty any day. Faslodex, which is another brand name, because I can't pronounce the other one, of a drug that would be really helpful for myself and for a lot of people. When I talk about Ibrance being good for me, it's not just me. There are thousands of people in New Zealand affected with breast cancer who could potentially take advantage of these drugs. So it's not completely selfish motivation. I want to keep contributing to doing good things for my community and for New Zealand. I've been here for almost 11 years, and New Zealand is very much home. I'm a New Zealand citizen now, and I care very, very deeply about this country and the people here. And I just want to see change to make it a better place to live. And I do that professionally and personally. I try and do things that make things better. And this fight to get an independent inquiry of Pharmac, to increase the funding, and to show a little kindness, I would really appreciate that.
That's Terre Maize talking to me from Te Kuiti.